The Mind and Body team is really an innovative and exciting project that we've been fortunate to undertake at King's in conjunction with Leukemia UK. And it's really bringing together all of the elements that you would want to deliver to patients to have truly holistic care which encompasses all of their needs. So it's bringing together a very dynamic team with a number of specialists from different backgrounds using their expertise to universally screen patients and then to deliver treatments to support their psychological and emotional well-being as well as looking after their physical needs. So it's really very unique.
How the Mind and Body team works is that we are a group of mental health specialists, and it includes a psychologist, a psychiatrist, a couple of psychotherapists and counsellors, as well as a social worker. The project itself is a novel initiative to try and see how it changes practice to routinely offer patients a chance to talk about their mental health when they come in for a physical health appointment.
As we all kind of know, our mind and our body is one entity. And when you go through something like a blood cancer, first of all, you're ill, so that takes its toll. Then you've got the treatment, which can be pretty intense, and the treatment burden can be quite high. And so naturally, that's going to have an impact on how you feel overall in yourself. If we can support your holistic well-being, then your body's going to feel better because your mind's going to feel better, and your mind's going to feel better because your body's being treated as one whole unit. A lot of the ethos of the project, of the Mind and Body project, is that we want to encourage everybody to be thinking about someone as a whole person. So thinking about your nutrition, your psychological well-being, and your chemotherapy, for example. I absolutely think that the Mind and Body project will help people deal with their cancer journey more positively.
These types of illnesses throw up so many emotional and psychological challenges for people. They bring about a lot of changes and losses that people need to come to terms with and adapt to, as well as, of course, the treatments and their side effects. So there's an awful lot going on for people, and it's most definitely very emotionally challenging, there's no doubt about that.
In my role as social worker in the hematology team, I focus on providing emotional and practical support to patients and their families. This is often encompassing emotional support, looking at the family's wider circumstances, and that could be their finances or employment or relationships or any area where they may need support, as well as issues of social justice and human rights. You have a life outside of the hospital that you go home to every single day, and that we are not only just paying attention and acknowledging that that is the case, but that we are directly there to support those specific areas of your whole life